Mr. Speaker, thank you. I briefly, as a member of this Committee on Health, I just wanted to highlight on a few things which I believe are very, very important to be able to clear any doubt from any member who did not get a chance to be able to go through the report, which was an oversight as to the work that the committee did. Mr. Speaker, this, as I rise to support the amendment in the report of the National Assembly, National Hospital Insurance Fund, the bill, Mr. Speaker, I want to note the following, that as a committee, we observed various things that were problematic when it comes to the issue of NHIF. The President and this country in general is seeking for a chance where everyone will be included and be covered by NHIF. Mr. Speaker, our committee listened very carefully to several stakeholders, including the Council of Governors, including the Ministry of Health, including private individuals, and most of them were seeking clarification on the issue of the board, who is going to be in the board, what powers will the board have, how effective will the services be rendered to the people. And Mr. Speaker, the submission that we received, we spent a lot of time to be able to go through them. And I'm happy to report that some of the areas that we enhance in the bill and the amendments that will be coming during the committee stage amendment revolves around accountability. We do not want a situation where the Cabinet Secretary is the only one who is informed of all the dealings of NHIF. We have now introduced a provision where any audit report which is carried out does not end with the Cabinet Secretary, it comes to the floor of this House. Mr. Speaker, sir, some of the other amendments that we brought, which we'll be discussing, has got to do with the application of the Health Act. We've got NHIF is now going to become a big insurance body to be able to incorporate everyone in this country. Mr. Speaker, sir, the amendments which were brought by the National Assembly wanted people who are unemployed to be contributing. We did away with that amendment. So those are amendments that we know very well that people are suffering to be able to put forward on the table, and we want them to be able to be considered as vulnerable people and can be taken care of. Mr. Speaker, sir, the other issue which I believe Senator Linturi had a concern on was that some people are given health care based on their contribution. Mr. Speaker, I want to assure Senator Linturi that as a committee, we considered everyone as being uniform. So it doesn't matter how much you contribute because we've got different pools. We've got people who work with the public sector. We've got people who work with the county government. We've got private individuals. And one of the most important amendments that we brought in, Mr. Speaker, is that if today you have employed a house help, you must provide that house help with NHIF. If you do not submit the payments on time, you will be responsible to pay for that employee medical expenses. So, Mr. Speaker, the work that the committee did is something which is going to assist this country. Because for now, when you turn 18 years old, it is mandatory for you to become a member of NHIF. The other issue which was very, very important, Mr. Speaker, is on the issue of prevention. Because we've been investing a lot on curative. But now the committee looked at the clauses that promote prevention healthcare and promote to ensure that all these health services, which will now be accredited, I requested for 3 minutes, Mr. Honorable Sakaja.
Oh, okay,
and I think my 3 minutes
yes,
are coming to an end. So I just want to end by stating as follows, Mr. Speaker, that we, as a committee members, spend a lot of time and we considered all the submissions of all the stakeholders. Because health is devolved, I want to assure Senator Linturi that whether or not you are poor, you will be able to get the same services that a rich person is getting. And that, I'm sure, will be able to help everyone. I support Mr. Speaker.